the number one reason you always have back pain, knee pain, or neck stiffness is not because of the type of work that you do. It's not because you think you need more rest. It's certainly not because your joints are aging. I am sure you have taken time off work. You've tried many different medications. You have even applied every ointment that you find to stop the pain. But here's the problem. You see, everything that you are doing is only treating the symptom and not focusing on the main cause. That's why the pain always comes back. Today, I'm going to show you the one thing that you must do to finally fix your back, fix your knee and neck stiffness for good. You see, most people think the problem is just old age, bad posture, or even stress. But in most cases, your joints need this one key ingredient to stay pain-free. The main cause of your stiffness is something that we call synovial fluid stagnation. And if you don't fix that, no amount of joint capsule, no amount of these expensive ointments will work permanently. I will explain this in a very simple scenario. So imagine the joints of your back, or let's say your knee or your neck, as two stones like my hand. In between them, there is a foam like this, a foam. And this foam is soaked with oil. The foam is called cartilage and the oil is called synovial fluid. As long as the foam is wet, the two bones can glide over each other. Over 100 years without any scratch, you wouldn't feel anything. But here's the problem. If you don't get the right ingredient, the foam dries out of the synovial fluid, becomes dry, it becomes thin and very hard. And instead of the bones gliding smoothly over each other, this time around they will grind against each other, and that will cause the pain and the stiffness you feel every time. So it's not because of old age, it's not because you have overworked your joints. It's because the foam is drying out of the synovial fluid, and if you fix that, it helps to get rid of the stiffness. So now, how do we fix this stiffness? I mean, your back pain, your knee pain, and your neck pain. There is one key protocol that I'm going to show you now, which oils your joints from inside out and make sure that the foams are wet. But I have to warn you, let me be honest with you. This key protocol or this fix will not work if you keep making these 5 common mistakes. First mistake is something that we call the cooling gel application or the ice trap. You see, for most people, when they have pain, at the back, they try to reach for cooling pain gel or use ice pack to numb the pain. It is true. It will reduce the pain at the moment. But here's what most people don't know. The cold also restricts blood flow to the joint. The joints need nutrients from your blood to heal. By freezing the area all the time, you are literally starving your knees and your neck of the very nutrients they need to repair. The second mistake is resting. I know you might be thinking, you are in pain, so you would want to sleep or rest, thinking it will help to save your joints. But it is actually the opposite, because the fluid, the synovial fluid, the oil, it moves when you move. So if you stay in bed all the time, the fluid becomes stagnant and very sticky, and that can cause more stiffness. Resting, if you don't do it well, can actually be one of the reasons why you wake up with more pain, like a 90-year-old person. Third mistake is one of the commonest mistakes that most people do: overuse of painkillers. This is what you do every day after your work. You either go to a pharmacy or you have this painkiller that you take in to help to manage or to reduce the pain. This is what you don't know. The painkillers are only masking the pain, and it is very dangerous because you might not see the actual problem happening down there because you wouldn't be aware of the warning signal until the damages become far worse. The very fourth mistake has to do with smartphone. If you are always tilting your head and then checking your smartphone, it can put pressure on the joint and can squeeze out some of the fluid, which can make the joint dry and causes more stiffness. The fifth one, this is, one of the commonest serious and dangerous mistake, because even your healthcare provider might be the reason why you are making this particular mistake. The calcium supplement mistake. You see, your healthcare provider usually will give you calcium supplement containing calcium and vitamin D to help to support your joints. But the problem is calcium without the key ingredient, instead of depositing in the bones, they deposit in the joints and the soft tissues of your neck, of your knee, and your back, causing more pain. So anytime you are offered any calcium supplement, ask your healthcare provider the right question. Make sure it contains this key ingredient that I'm about to talk about in the next few minutes. And that leads us to the fix, the key protocol. You see, you don't need more calcium. You need a certain level of calcium, and vitamin K2 is the key ingredient. Vitamin K2 will do two things. It will make sure that the calcium is deposited in the bones to make the bones strong. It will also pull those calcium which are found in the soft tissue or the joints and deposit it in the bones. In this way, you get a strong bone and a soft, flexible joint, which helps to reduce friction, the stiffness, and reduce the pain. But you see, before the vitamin K2 can get to the right place in the joint, you yourself, you have to do one last thing, just one thing. Every morning when you wake up, before you get to your phone, spend 60 seconds doing slow, gentle circles of your neck, of your knee, of your hips, if possible. This will serve as your morning flash to squeeze out those old stagnant synovial fluid and bring in new synovial fluid, which is rich in this vitamin K2. Do this for 7 days. Stop the cold pain gels and prime your joints.